Test, test, test. 1, 2. I'm just keeping it going, man. Test, test, test. I'm just keeping it going, man. Keeping it real. Is it going? Do you hear me, Joe? Testing, testing. 1, 2. Can Joe hear me? Are we screaming out? Is it exciting? Testing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Test, 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 test. Hello. 1, 2, 1, 2. 1, 2, 1, 2. Hello, 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 hello. Hello, hello, hello. Hello? Are those headsets any good or are they crap? Test, 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 test. Test, test, test. Try your earbuds, Joe. Make sure something's coming through first. Test, test, test.
You can hear me? Okay.
Test, test, test.
Go ahead and check your settings here.
Test, 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 test. 1, 2, 1, 2, 1, 2. Hello, everybody. Hello.
You should be able to hear me. Nothing yet?
There's nothing coming through the headphones.
You go ahead and talk to me. Yeah, can't hear you. Let me call you again, okay? I'm going to call you again. No. Nothing yet. Let me call you again.
Hey, Frank, I missed you there.
Hey, that's all right, Adam. I just wanted to introduce to you Tyler Martinovich, who's here to my side. There he is.
Hey, Adam.
Hey, Tyler, how are you?
Good. So we'll be talking here in a little bit. Do you have any specific questions you want me to ask you?
No, anything you throw at me, I'll be fine with that.
Okay.
If you want my qualifications, I can tell you, so you know it ahead of time, I'm board certified as a workers' comp specialist in New Jersey. I'm board certified in civil trial attorney. I've run my own practice for 25 years.
One, two. Test, test, test. So test. 1, 2.
Thank you for joining us this morning. I'm Tyler Martinovich, Film Commissioner for Hillsborough County. As you can see, we're back in the same space we were last time. I want to appreciate Kestum Bilt for helping to put this together. We're having a little bit of technical difficulties with Skype, but we hope to have that resolved here in a second. We'll be joined shortly by John Lux from Film Florida and Brandon Marshall from the Mainsail Group and Dark Door Brewing. Hope to talk to them in a moment. But in between, let's just talk about the state of Tampa Bay and where we're at. As many of you know, sure, we'll get some questions here in a second. But as many of you know, we do now have a stay-at-home ordinance in place, both for the city of Tampa, as well as Hillsborough County, Pinellas County, St. Petersburg, and a curfew that's going to in effect every evening from 10 p.m. to 6 a.m., I believe, Monday through Friday. And then over the weekends, it is a 24-hour curfew through Monday morning at 6 a.m. So that's where we're at. Not a whole lot of film business going on, but we're all in the same boat. We're trying to stay afloat and doing our best to stay in touch with our clients, to let them know where we're at. Not just myself, but also the St. Pete Film Commission is doing likewise, as many of the film commissions throughout the state are. We just had a conference with Film Florida that wrapped up on Wednesday of this week, sort of talking about the state of affairs throughout the state. We're all going through a rough period. That's not going to change this week, certainly, and probably not next week, and it might even be until the end of April that we start seeing normalcy back into our lives, possibly well past that. But the reality is this is a very difficult situation, and we need to be doing what we can to make sure we're social distancing as much as we can, following CDC guidelines, and really looking out for one another. So that's where we are at. My office will continue to be open. They'll be working from home until this ends. So if anyone has any questions, you're always welcome to reach out to us directly through our website, filmtampabay.com. Or please follow us on social media. We're trying to be as engaged as we can through there to get out information as quickly as we can. How are we doing there, Frank?
We're doing good now.
Doing good? Okay. We'll be starting up here in a second. Do I have any questions from the audience?
We do have one question.
Sure.
Right off the bat is, what is the permitting state going on right now in Tampa?
Okay, so the question is where we're at with permits. Tampa Bay, and since we just had that Film Florida meeting, I can speak more broadly throughout the state. Right now, most municipalities have suspended permitting, and it's really because loss prevention agencies throughout the state are looking at how general liability is written and insurance policies are written, and pandemic is not a word often associated with a lot of these policies. So there's a struggle right now to understand what is or isn't covered, who's liable. Miami has taken the position that unless you have a specific pandemic rider, your insurance policy might not have the appropriate coverage. Certainly that's something Tampa and Hillsborough County at large is looking at as well, and I think a lot of different film commissions are starting to look at that. So until that language is resolved, and whether you need a pandemic rider or not, we could see a prolonged period of time where permits are just not able to be issued. We hope that's not the case, but it's an evolving situation. So with that, I'm going to switch chairs, if I can go back over here. All right, I think we have everything resolved. So joining me now, I have two good friends of mine. First, Brandon Marshall from Mainsail Group, which is a hotelier and property management company, as well as the co-founder of Dark Door Distilleries. Did I say that right? It's Dark Door, right?
Yeah, Dark
okay.
Spirits, you got me.
And also joining us is John Lux, Director of Film Florida, which is our statewide trade organization. Great to be joined by both of you guys. Let me start with Brandon. John, I'll get to you in a second. Brandon, how are you doing personally? How about you and your family?
So very fortunate where I've been able to work from home to manage my teams in the hotels. Right now with reduced business levels, it's been pretty manageable. And actually, kudos to Hillsborough County. We've done a really good job with the schools. It was a little bumpy the first day, but the kids are really getting in the groove. So hats off to them for making it work right.
Yeah, fantastic. And John, how are you doing, you and the family?
We're actually doing really well. For the most part, not a whole lot has changed with us because both of our kids go to virtual school, and my wife and I both work from home normally. So outside of dance, soccer, and basketball, the life really hasn't changed too much from a personal standpoint.
Yeah. Well, I'm glad for you, and certainly for you as well, Brandon. I've been going out of my mind. Normally, I don't have to be stuck in my house all day, every day. So this is actually a blessing to be out and about on a Friday, at least this week. So, Brandon, let's get with you. There's just been a huge community response to wanting to help out and be involved in the cure to this malaise we're under right now with COVID-19. I know that Dark Door Distilling has transitioned to actually making hand sanitizer. Tell us a little bit about that.
Yeah, it was pretty interesting. It was a bit of a novel idea, actually, originally. But now, 2 weeks ago, or whatever that was, I don't know, I've lost track of time, where Motorworks Brewing had some product that we were working on, a whiskey and a gin with them. Literally just kicking around an idea on Facebook Messenger with the guys, like, oh, hey, we should make this into sanitizer based on what we're seeing. And so we started that process. It really wouldn't have been able to be labeled sanitizer. It would have to be a cleansing agent, which some of the other breweries did as well. But then last Tuesday, the FDA and the TTB, which is the portion of the alcohol, tobacco, and firearms that we deal with, basically send out an approved recipe to anybody that belongs to the distillers, the National Distillers Guild, saying, here's the recipe, here's the formula, make it, and distribute as much as you can. So we were really fortunate. I was actually on personal vacation last week, so I was able to spend a lot of time at the warehouse, and so we did with Motorworks a sanitizer they were able to give out at the brewery. We actually gave some stuff out at our distillery location, which is in a warehouse. But then the guys actually went out. We had some great partners on this one. Hit Promotions donated some supplies to us so that we were able to get it out to first responders, postal workers, the day-to-day guys that really need it. And there is such a need for this stuff right now. It's insane.
That's awesome, buddy. I really appreciate that. I know everyone in Tampa and Hillsborough appreciates both you, but also all of the breweries and distilleries that are trying to make a difference right now. So on behalf of myself and my staff, we thank you, obviously.
Hey, and then just to plug on the hospitality side, as a whole thing, obviously my main business is with Mainsail Lodging Development and the hotels, which our hotels are actually doing pretty well. Obviously reduced business levels, and most of our properties aren't big group properties like the folks in Orlando who are really hurting. So my little plug to everybody today is, don't cancel something. If you have a reservation on the books, just move it. Anything, reach out to your hospitality friends. I know everybody's got some. And anything that we can do to support the local community, because really, the line level folks, the bartenders, the servers, the front desk people, really hurting right now. So anything that we can do to help them is really appreciated.
No, I appreciate that. And your two properties in the Bay Area specifically are the Epicurean and the Fenway, correct?
We also have the Carole Hotel in St. Pete. Okay. So we've got technically 4 properties in the market. So the Epicurean in South Tampa, right across the street from Burns. The Fenway Hotel out in beautiful Dunedin. The Carole Hotel, which is right in Carole Park. And then Waterline Marina Resort. So they're all Marriott franchised as part of either the autograph collection or tribute collection. Yeah. So again, anything that we can do to support our local community is what we're trying to do in all aspects.
Fantastic. And specifically for Epicurean, just because we're in Tampa right now, you guys are doing roadside pickup, right, through Elvage still, is that correct?
So, because Burns and Haven are doing so well with it, that we've actually just said, you know what, no big deal. Elvage, we're just going to shut it down for right now. We're going to focus on any guests that we have in the hotel we're providing food for. And then really letting Burns and Haven do the to-go thing and do it really, really well.
Okay, fantastic. All right. John, let's switch over to you now. What is Film Florida doing right now, both in terms of messaging to members, but also helping to continue to market Florida as a filming destination?
Yeah, well, regardless of what's going on in the world, we're continuing with the Film Florida podcast, which has stayed completely on schedule, where we interview folks from the industry that have ties to Florida. and just talk about their experiences and what they do in the industry. So that continues on an ongoing basis. We have a new episode up about every week. And then specifically for the virus situation, our role right now is primarily information. We're trying to make sure that our constituents have the most up-to-date, correct information so they can be safe, whether that be just where they can film if people are still interested and available, which, as you mentioned, is very, very little, but making sure people know what officially is closed, who has revoked permits, who's still giving permits if they need them, as well as things like unemployment. Our industry is primarily freelance workers, and so there's a huge concern about the traditional unemployment system on whether or not workers are going to be able to apply for that. There looks to be some real good progress on that, and so hopefully our industry professionals, the ones that are freelance, are going to be taken care of and be able to apply for unemployment and still get some of the federal stimulus package as well. And so our mission right now is just to make sure that people have accurate information all in one place. We have it up on our website and actually 2 different places. So if people go to filmflorida.org, it's right there on the homepage. If you scroll down a little bit, then we also have it on our news page, all the most accurate information from industry resources as well as state and federal.
Yeah, and that's also been linked in our own internal newsletter we pushed out. And for people following us on Facebook, we are also retweeting anything that Film Florida is putting out there. So let's not focus all on doom and gloom, John. Let's talk about a couple of the small legislative wins we've had, at least as far as right now. So where are we at legislatively, specifically with talent agencies?
Yeah, so 2 weeks ago, when which seems like it was about 5 years ago, when the legislative session was winding down, the industry got 2 major accomplishments from a talent agency perspective, as you mentioned. So the global goal of legislation these days is deregulation. That's kind of a buzz term. The idea is to open jobs up for more people, and I get that. And so somehow, though, talent agents got lumped into that group of professions that should be deregulated. If that would have occurred, people that are unqualified and have bad motives could call themselves talent agents, put out information, try and ultimately take advantage of Floridians, whether it be the youth that are getting into it, or even some of the elderly folks that are still acting. Not to mention, obviously the day-to-day folks that are in there as well. But the idea was we did not want a public safety issue, and that's exactly what it would have been. So, with some great help, primarily from Senate President Bill Galvano, we were able to defeat that portion of that bill and get talent agents pulled out of the bill. So talent agencies are regulated just as they have been to make sure they have the proper insurance and the proper bonding and background checks and all of these things to make sure that the appropriate people are dealing with talent here in the state of Florida.
Yeah. A small win certainly in the context of what's going on right now, but we're going to come out of this, and we're coming out of it stronger because of legislation like that. So certainly appreciate Film Florida taking a lead in the lobbying efforts and in really spreading the good word in Tallahassee. So thank you, John. Back to you, Brandon. We are going to come out of this at some point. From a hotel perspective, and you don't have to talk specific to mainsail, maybe more general, what is the hospitality industry trying to do to make sure they're able to come back online once this is over?
So, you've probably read in the news, and if you've not watched Arnie Sorensen's video about furloughed employees, that's really, we're still trying to keep them engaged. Our group has actually set up an employee-based website that's got a lot of information for our employees on what their benefits are, how to understand the new bill, and really just resources for them. And I think, we've already started talking about what the cycle is going to look like of when we can really start bringing people back. Because to your point, there's a little bit of a ramp back up time. When do we start to see people start to get back to work? And with Tampa now going on our stay at home for the next, I think, 2 weeks, right?
Yep.
Yeah. it'll be interesting to see, the end of next week, what the hotel situation starts to look like, because, there's a cancellation process, right? And we've finished that portion of it where I think what's going to cancel has been canceled. And really, we haven't seen parts of May cancel yet. So there are the back half of May. Most of my properties still have a decent amount of business on the books. But we're calling our clients and we're finding out what they're doing. And I think that's really what's going to understand our timeline, because as soon as I have clients that say, yep, we're going to be there on this date for sure, is when, we know 2 weeks in advance I have to start bringing people back.
Yeah.
So I think that'll be our shift.
Okay. This 15-minute segment so quickly, so we need to wrap it up. John, is there anything you want to plug before we say goodbye?
Well, I would say make sure you keep following the Film Florida podcast. We're available on Apple, Google, Stitcher, and iHeartRadio. Just literally a couple minutes ago, we rolled out a new campaign, which is the Sunshine State Social Distance Watch Party, which we're highlighting some great film and television projects that have been done through the years in Florida, and we're encouraging people with this extra time to watch some great work that our industry has produced over the last few decades. We're going to roll out the first volume today, and then we have another volume next week, which is the family-friendly version. And then 2 weeks from now, we have volume 3. So we're looking forward to getting that out and giving people some things to do while they have some downtime.
Fantastic. And I certainly recommend everyone tune in to the podcast in particular. You've had some amazing guests this year, so I hope everyone joins you both through the website and social media. Brandon, anything you want to plug before we say goodbye?
Again, just keep an eye out for our hospitality workers. Anything you can do for your hospitality friends, please do. And then on the Dark Door Spirits side, feel free to follow us on social for what we're doing. And if you need sanitizer or you have a need for sanitizer, you can send us an email, darkdoorspirits.com. And obviously, we're a little backed up right now. Demand's high, but we'll get to everybody and as soon as we can.
All right. Appreciate you both. Thank you guys so much. Stay safe and stay healthy.
Thanks, Tyler. Appreciate you, brother.
Thanks, Tyler.
And for everyone else, we'll be back in a few minutes with attorney Adam Contler. Join us then. See you in a second.
As filmmakers, we understand that a setting is more than a location with character. It is a character with an energy, a history, its own unmistakable style, and beauty. When you find the right spot, your wildest dreams have a place to come true. All right here in Tampa Bay, Florida.
Hi, and welcome back, everybody. Again, my name is Tyler Martinellich, Film Commissioner for Hillsborough County. Joining us right now from New Jersey is attorney Adam Kotler, who is a workers' comp attorney, I believe. Thank you for joining us, Adam. First question I'm going to ask all of my guests, how are you and the family doing?
Hold on, guys.
No, thanks, Adam. Give me 1 second, Adam. We're having a little technical difficulty. We're ad hoc here.
But you can't hear.
Yeah.
So give me a second. Here, let's do this. Okay, see if he comes through.
Go ahead and say something for us, Adam.
Yep, how's that?
There we go. Thank you, buddy. So let's get into the meat of this. This is an interesting time period we're living through right now. I can't tell you in the last 20 years I've heard the word pandemic used outside of maybe the N1B1 or H1, which came through a couple of years ago. So as far as workers' comp goes, and let's preface this by saying anything you mention is just your own opinion and seek your own legal advice as a caveat here. But what is an employee culpable in terms of workers' comp during a pandemic? If an employee becomes sick as a result of unsafe work practices, or not following CDC guidelines, or they forced or pressured their employees to come in an unsafe way and they end up sick as a result, does workers' comp apply in that case?
Sure. So the question kind of an overlap between the workers' compensation law and the regular employment litigation laws. So in New Jersey, at least, and that's where I'm licensed, that's where I do my practice. So the advice that I give is generally restricted to the New Jersey, that's where my license is. For New Jersey, an employer is responsible for workers' compensation benefits for an employee who establishes that there's a link or causality and connection between their condition, like getting sick with the coronavirus, and their work environment. So in order to make that establishment, there needs to be good scientific and medical evidence, both of an exposure as well as the contraction. And they're two different issues. So we may have all been exposed to somebody already with the virus, but not have had it actually affect us. We weren't yet affected by it. So in an employment situation, if we've got somebody who is actually exposed and a confirmation that there is a sickness that comes from it, the workers' compensation benefits would apply. And in New Jersey, like most places, there are 4 primary benefits. So the first one is the medical treatment. Once it's determined that there is a reasonable degree of medical evidence that connects the exposure to the sickness, the employer will be responsible for any and all expenses for the medical care. The employee has no co-payments and no deductibles. Now, that might be superfluous because we know that the government is also picking up federal government is picking up coverage for all of these expenses as well. The other benefit in New Jersey would be a wage continuation benefit for people who are affected by it. In New Jersey, we get 70% of the pre-exposure weekly benefits. But again, here there's an overlap with the federal government just passed the CARES law, which provides for supplemental benefits for people who are sick with the corona disease, the virus flu as well. The third benefit, and probably the one that's not provided for in any other venue so far, is a permanent partial or permanent total disability award. So in New Jersey, if you can establish by reasonable and credible medical evidence that somebody has a material effect on their body and they can't do everything they could do before, there's this entitlement for a disability award. And it's based upon a number of factors. The amount of money the employee was making before the exposure or the disability, how significant the disability is, what percentage of loss they've suffered, and then ultimately a cap based upon certain earning capacities. So those are the benefits that would be applicable. Now, God forbid, and I hope it doesn't happen with anyone, but if there's a fatality that's linked to and associated with this, their dependents would be entitled to a lifetime of benefits at the deceased prior rate of compensation, 70%.
So, I mean, just let's be speculative right now, looking out into the future. Do you think there's going to be a rash of workers' comp lawsuits, or at the very least, a rash of people trying to apply for workers' comp post whenever COVID ends?
So it's interesting. I think right now where society has been, at least those people that I have been talking to have not been claims oriented. And I truly believe that we're in that state of affairs right now that people are looking out for their health and safety, number one. And then number two, trying to adapt to the new way of living. Mm-hmm. I believe as the sickness and the virus spreads and more become affected, people will be reaching out with more direct questions about, can I establish that link to my workforce, my workplace? I'm going to tell you it's going to be very difficult.
Yeah.
And I'm a very aggressive workers' comp attorney. I mean, I don't mind saying that. Nobody likes an aggressive attorney unless they need an attorney, and then they only want an aggressive attorney.
Of course.
We tend to treat people how we would want to be treated if we were clients, so we're pretty aggressive.
Yeah.
As aggressive as I am, I think it's going to be very difficult to establish that scientific link that the exposure happened at work. Now, that's for the vast majority of employees. So if I've got an office worker and the office doesn't have a splattering or a center of infection that spreads throughout the office, but one employee gets it and only one, it would be almost impossible epidemiologically to say that was a work exposure.
Sure.
Contrary to that, if I've got somebody who's sick at the office, and we've closed our office to work only remotely during this time so that we keep our workers safe, but if I have somebody in an office and there's a cluster, out of 55 people that work in our firm, if 40 of them became affected, I would say that the common sense proofs as well as the epidemiological proofs would establish a causal link between the work environment and the sickness, which would be required.
Yeah.
The difference also applies when you're talking about healthcare workers or first-line people. We're seeing, unfortunately, some of those brave men and women who are in the hospitals, who are in the emergency rooms, and who are still caring for people. Those people are the ones who have a higher likelihood of being able to maintain a claim for that because their exposure is materially more likely to be based upon their work environment.
Yeah. So in the previous segment before you joined us, we were talking very briefly about how general liability insurance right now may or may not apply if you do not have specific pandemic wording within your insurance clause, and the reality is 90% of people don't have that. So unless you have a specific pandemic rider, you may or may not be insured right now through general liability, which is very important to the small business owners who need that as a pre-qualifier for any sort of permit they might need to pull from a governmental agency. But on the workers' comp side, has there ever been a precedent where there has been a pandemic and there has been a need to activate workers' comp as a result, or are we sort of in the Wild West here as far as just dealing with this?
So it's interesting, Tyler. In the 24 years that I've been doing workers' compensation, I've never seen anything like this, of course. Right? Even any of the other flus, any of the other communicable diseases that you could try to tie to that causal relationships that's necessary, I've never seen a strong push on that. But we've never seen anything like this before. Yeah. We've never seen one that's as fatal with this rate. We've never seen one as communicable. We've never seen it spread so fast. So I believe that there will be some people that make that attempt and that push, and it'll be interesting to see where the judges go with this. Now, workers' comp, by its very nature, is deemed to be social legislation or benevolent legislation designed to cover as many people as is possible. So where most of the times you've got to prove your case by preponderance of the evidence, meaning more likely than not, you get a lot of leeway in workers' compensation. The standards for proof are a little bit lower, and you get a little more inferences. And generally speaking, the goal is to include everybody in workers' comp benefits.
Yeah.
Having said that, this is still a tough pill to swallow, I would say, for every workers' comp insurance company out there and every self-insured employer. Because unless, as I was talking about earlier, that cluster occurs at a work environment, no one is going to voluntarily pay the workers' compensation benefits. And candidly, even as aggressive as I am in trying to get my benefits for my clients, I don't necessarily see it. So I think that causation is going to be a big issue. Now, you raised a really interesting question about the general liability. So in addition to the workers' comp practice, I also handle a wide variety of civil litigation matters. So you've got two separate parallel courses that you're talking about on the other insurances. So one of them is called a business income continuation, and one is a business owner's liability policy. Now, we've seen some unfortunate circumstances locally where I am, where some food workers have become affected by the virus, and that they may seem to be the trigger for an outbound spread. Now, some of the facilities have closed based upon that for extensive cleaning, because once they identified that as a source, now the Department of Health is trying to trace out those that may have been affected. I believe, as hard as it is in workers' compensation to establish that cluster, this is going to be the one time where it may actually be a little bit easier to establish on a civil liability portion that there was that connection. Now, getting it alone isn't going to be enough. Having the virus transmitted from a worker at a self-serve restaurant like that to the consumer is not going to be enough. You need to show negligence in the superior court, in the civil court system, something you don't need in workers' comp. In a workers' compensation case, all you need to show is causality, meaning the connection between the work and the injury. In superior court, in civil trial work, you need to also show that the responsible party, the defendant, the store owner, was negligent, meaning they failed to do what a reasonably prudent person would do under the circumstances. They breached a duty owed, and by breaching that duty, they allowed a condition to exist. So, the question is, what is negligent in these environments? We've been hearing wash your hands 20 seconds frequently. We've been hearing don't touch your face. The question is going to be, what could the store owner do in order to prevent the spread? If you've got an employee who is asymptomatic, you have an employee who is not showing any visible signs that they have the virus with them, and that employee then cross-contaminates, what could the employer have done? So other than shutting down the facility completely, it's going to be a hard argument to say more precautions should have been taken. Now, if an employer, the restaurant or the takeout facility, isn't putting in universal precautions, isn't requiring hand wiping, isn't doing the masking that we're seeing so many of them do, then maybe there's an argument. That's a very different situation where you've got somebody who's working behind a line, sneezing, coughing, sweating, having a hard time breathing. I think there's nobody out there reasonably putting that worker in the line. But I think other than that, it's going to be a difficult case, but if you follow out the clustering, there may be some viable claims on the general liability part of it.
That's really interesting, particularly just how you draw the line from causality to the employee and what they may or may not be responsible for when the guidelines themselves seem to be changing almost daily. I mean, you look back to last week, the CDC was recommending no groups of 250 or more, no groups of 150, and then 10, and that all happened over a space of a few days, if not hours, where it was changing rapidly.
Yeah.
So I guess the question is, I mean, how liable is a business owner when the goalposts keep moving every 5 minutes? I think that would be a huge hurdle to overcome as far as proving they were culpable.
Yeah, Tyler, I agree with you. This is a really fluid situation. And I'll take my lawyer hat off for a second. I'll put my business owner hat on because I'm one of the partners at Carole, Hernandez & Cohen. And as a business owner, I look at not only my responsibility to my clients that I have as a lawyer, but I have a huge responsibility and obligation to my staff. We have 55 people in our work family. So we stayed ahead of all of those government recommendations. We were socially isolating before it was a term of art. You know, we reduced our staff meetings. We would always gather we have a big lunchroom, but even in a big lunchroom, we were still sitting right next to each other. And before the government was saying separate, we started implementing separation. You know, we stocked up on the wipes because I want to be there proactively for the people that I work with, the people that are part of my work family. Now, if you are ahead of the government recommendations, then clearly liability would be much harder to establish. Somebody trailing behind at least would be a little bit easier because if you have no standards, you're left with an open question. But once the standards are set, I believe that failure to follow them will not be evidence per se, but it'll certainly be evidence of negligence.
Yeah.
So it's not going to be negligence per se that once you violate it, that you will automatically be culpable for the financial harm. But if there's a standard and you violate it and you can connect that standard violation to the affected person, that's, I think, when the liability is going to come, and fairly so.
Yeah.
But at least in my world that I'm going out rarely out of my own house, I've gone to the office one time over the last week and a half. We set up a complete remote workforce for our people because we care. We want them to be isolated. We're connecting with video conferencing like this one. We have our staff meetings this way because we still need this physical connection, even if it's only electronically physical.
Yeah.
We need to see each other. So I look at this as the business owners that are doing nothing should have some culpability, but most of what I'm seeing is people are being very proactive about it now.
Yeah, I think
in my region, in New Jersey.
And I think that's true really across the board. People are really tuning into the needs of their employees. So with that, Adam, we have to wrap up a really quick 15-minute segment here, but I really appreciate the time you took with us this morning. Some really interesting stuff. The best to you and your family, and I hope you guys stay safe and healthy through the remainder of this crisis. So thanks again, Adam. Really appreciate it, buddy.
Thank you, Tyler. Thanks for having me on the show, and I hope the same for you, your family, and the other web audience.
Thank you so much. Appreciate it. And with that, guys, we'll be right back with DJ Fresh. Tune in. Welcome back, everyone. Again, my name is Tyler Martin-Nolich, Film Commissioner for Hillsborough County. We will be having a DJ Fresh in a different segment. We're having to do some audibles here. So in this segment, we are lucky enough to be joined by Dr. Guzman from Medi Weightloss to talk to us about the medical stuff that I know nothing about. So, Dr. Guzman, thank you so much for joining us. Really appreciate you being here today. Question I've been asking everyone, how are you and your family and your staff doing right now through this trying time?
It's certainly an unprecedented time, as we all know, and we've been aware over the past couple of weeks. And I'd like to say that, we're just kind of trucking through and taking each day as it comes, and understanding that given the time that we are in, we have to basically do what we can do, and that's prepare for what's coming in the next couple of weeks to the next couple of months. So I'm more than happy to delve into some of the questions you may have, and certainly look forward to discussing anything that you're interested in learning.
Oh, really appreciate that. So prior to having to work from home for at least the last 2 weeks and probably another month after this, I've never heard the term telemedicine before, and it's something that our own HR has been pushing, especially in this trying time. If someone can take advantage of telemedicine, let's also define what telemedicine is, as opposed to going into a clinic or a doctor's office where they might be inadvertently exposing themselves. Would you suggest they take the telemedicine route?
Oh yeah, most definitely, especially given these circumstances nowadays where we're trying to do a lot of social distancing, and which in essence is also physical distancing. And anytime that you are face-to-face, potentially with really anybody at this point, they can be potentially transmitting, especially even if they are not exhibiting any symptoms. So if we can minimize that face-to-face, and there are other alternatives such as technologies, then I would certainly suggest and recommend it's definitely the best way to go. That way you're safe at home, and then that way if you're looking at a provider or really anybody, it can be friends and family, it's another way of still maintaining the social contact, so to speak, but ultimately, focusing on the physical distance and figuring out that you're not going to be face-to-face in person per se.
Yeah.
So telehealth is certainly something that has been growing over the past decade or so as technologies have evolved, and I think that we're really in a unique time and place now where we're essentially forced, unfortunately, given the circumstances, we're forced to kind of have this other alternative. Which, from what I know, at least within our clinics and our locations, we have over 100 locations in 30 plus states. Telemedicine is something that I know we've been also focusing on even before this all kind of happened, but it's certainly been a fairly easy transition for us as a franchisor in this case to implement telemedicine sort of options for our patients. So we're super excited to offer that as well.
And again, I hadn't heard of telemedicine until this crisis came up. How prevalent is telemedicine amongst general practitioners and specialists? Is it something that's been widely adopted and I just wasn't aware of it, or is this rather new?
It's fairly new. I'd say probably you're seeing more of an increase of it over the past couple of years. A lot of the third-party payers have now started covering more the telemedicine, telehealth sort of options. I know also options in mental health services as well as just general acute options for cold and even trying to have another opportunity for the clinician to really ask those questions and assess prior to even seeing somebody to really see what those symptoms are and maybe making a determination so that they don't have to come into the clinic and expose other people. And that's really with any other type of infectious disease. But it also works for one-on-one also with specialties as well. I can tell you, just on a personal note, I received a recent email from my ENT's office, and they, even though I've never actually thought of having to go in to see the ENT via telehealth, but it's something that a lot of the specialists are now also adopting as well.
Mm-hmm. And from a doctor's standpoint, with the obvious limitations as far as diagnostic ability using telemedicine, do you still feel there is enough of a reason to communicate with your patients that way and still be on top of their needs, or is it really a limiting issue for you as the doctor?
Well, I think it also depends on, as the the specialty as well. I can tell you in bariatric medicine, specifically, I can only talk for weight loss, we see our patients on a weekly basis, and it's part of that accountability process, which is something that can continue even through telemedicine and telehealth. However, does become a sort of a hindrance, at least at the beginning, where our patients are going to have to get a physical exam, for instance, or a full medical workup, and then we have to obviously do blood draws, et cetera. And that's really where it's a limiting factor right now, given the circumstances. But I think that this is so unique right now that moving forward, once this whole issue of the pandemic irons out, it's something that we could certainly implement, at least in the latter part of the follow-up visits versus the initial visit. But right now, we're kind of having our own sort of issues that we have to iron out on that end. And that's something that I know moving forward, at least within our locations, we haven't really had a problem with the follow-up visits. And patients actually do enjoy being able to still be accountable through at least their weight loss efforts.
Sure. By
having that conversation one-on-one, although it's via the phone with our providers.
So let's talk a little more general now about just the healthcare field in the world as it is today. And the caveat, you have your own clinic and specialty, but at large, do you believe that most of the healthcare professionals or institutions like hospitals and other clinics were sort of caught flat-footed by this pandemic? I mean, why don't we have the medical tools that we need in the volume we need? Why wasn't that accounted for, in your opinion?
Well, I think that it's a multifactorial. There's a lot of factors involved with that. I come from a public health background, so I'm a trained epidemiologist, and I can tell you that it really comes down to resources, and I know that at least on the public health front, there has been a lot of cutbacks, for instance, either at the local and state and even federal level over the course of the past couple of years, which clearly reducing some of those resources invariably makes us ill-equipped, in my opinion, to handle essentially when we are now confronting an influx of potential not only infections but hospitalizations. As far as your question related to, and I think you're probably alluding to more so like the protective, personal protective equipment.
Yeah, the masks and the
technologies and whatnot. Where I think as an infrastructure-wise for the U.S., as far as the way that the healthcare system is structured, is that we don't necessarily have a nationalized system, right? So ultimately, there is sort of this almost piecemeal, fragmented aspects of, a local hospital having a certain amount of resources versus a larger city metro hospital that would have arguably more resources. But the bottom line is that having hospital beds is very costly. As well as having all these other technologies that, we are a fairly wealthy country, and understanding that typically when it comes to, emerging pathogens and whatnot, although there may be some planning that's done preemptively over the years, quite frankly, we really don't know what our capabilities will be unless we're actually there. And unfortunately, in this particular case, this is where we find ourselves now. So this is essentially an issue, and I can tell you, and again, this is totally my opinion, is that ultimately the only way that we're going to get through this is if we keep our healthcare force, those that are at the front lines, healthy, so that we have ample. And it's great to have the resources. It's great to funnel all this money into getting the ventilators and the masks, et cetera. But at the end of the day, it's that person, that's the healthcare worker that's there. It's highly trained. Once that person gets sick, it's really difficult to then allocate at least the human resources part of that to then mitigate a lot of these issues.
Yeah. So we've been hearing a lot about flattening the curve. What are epidemiologists, the CDC, the government, what are they looking for as far as statistics go to give us the all clear that we can sort of go back to normalcy or get back to work? I mean, what is the data they're looking for that would make them comfortable to say this is past or this is lessened to the point where we can get back to work?
Right. That's a great question. So on the from an epidemiological standpoint, the flatten the curve is where you really want to be. So there's, obviously an axis. It's the number of infections that are growing, or basically the incidence rate, or the new infections or new disease that are coming out. that ultimately then translates to prevalence rate, which is the existing diseases. And on the other axis, you essentially have your resources, your number of hospital beds, and access to that. It's when the number of infections gets so high that ultimately a lot of people end up in a hospital setting is really where a lot of those other resources start to drain. So in order to flatten the curve is you want to make sure that that curve as it increases is actually flattened so that it's under that threshold where hospitalizations would be way too much, where in effect these hospital systems are not going to be able to handle. So that curve can be very country specific, as we've learned. In China, it can also be very location specific, as we learned in regions of, let's say, in northern Italy, for instance, before they started instituting these other containment measures. In the United States, it's very interesting, and I've had this discussion with some of my other epi colleagues, is that because we are in such a vast country and there are such vast regions, we fully expect each individual, whether it's, we're talking about a city, a location, a state, even a region, will have their own sort of curves. And that's essentially what we're seeing. It's what we saw in Washington State, it's what we saw in what we're seeing in California, and especially New York now as sort of the epicenter. And so what we would be able to learn, what we've learned from other countries, for instance, is how do we mitigate the increase of new infections? And we do that through instituting proper public health controls, such as containment, such as social distancing, as well as other public health measures such as contact tracing, for instance, which is something that once you identify a case, you want to be able to identify others. However, when it turns into a community spread situation, a community transmission, it becomes more difficult to then control through contact tracing because of the number of infections that are now sort of transpiring. So the flatten the curve is very specific, I said, so this is the answer kind of in a roundabout way. It's very specific to the location. And as far as how that would translate in one location to the other, again, it goes back, we don't really know that yet, and even an aggregate or an additive sort of effect to that. However, there is a lot of projections, at least where the peaks are going to be for some of these curves, at least within a couple of weeks. I know that there's been some talks, another 2 to 3 weeks in peaks, for instance, in places like New York and whatnot. But the reality is that there are other parts of the country that clearly are now at sort of the bottom of that curve and are going up. And that's why we're going to see these sort of hot zones in different parts of the country that maybe will have the same effect or not. And it is all going to be to what is going on in those locations. How equipped are those local public health departments, or those state departments? And then also, how are people following those containment measures? I know that there's been a couple of discussions as well, is that there are folks out there that are not taking this seriously, and then what do you do in those instances as well? So I hope that kind of answers your question. I know it's a lot, but... No,
it absolutely does, and I really appreciate the in-depth answer. We keep hearing flatten the curve, but I don't think enough of us really understood what they meant by that, so I really appreciate your answer. Unfortunately, we're running out of time. Last couple of seconds here, Doctor, is there anything you'd like to plug as far as how they can get in touch with you? Where can they learn more about Medi weight loss? Anything you'd like to share?
Yeah, of course. So I am currently working at Medi Weightloss as the Chief Science Officer and Principal Clinical Scientist. So I oversee all clinical research and program development. Medi Weightloss has been around for 15 years. We are still growing. Like I said, we're a fairly large system. We focus on non-surgical bariatric medical weight management. My previous life, I did infectious diseases, and now I'm applying a lot of the epidemiological sort of framework and tools and techniques to chronic disease management. And I think the last thing to understand is that each country out there, especially with this pandemic, is having their own sort of epidemiological profile or demographic. We've seen it in China, we've seen it in Italy. And my concern here in the United States with the chronic disease issue that we have, whether it's obesity, metabolic syndrome, type 2 diabetes, non-alcoholic fatty liver disease, all chronic issues that are all kind of interrelated. Unfortunately, we are a country where we are affected with these other epidemics, concurrent epidemics. And my concern, I think, as an epidemiologist, understanding, even the risk factors associated with that. And that's kind of really what I want to leave is to, let people understand that that, just stay safe out there, and please follow your local recommendations, especially when it comes to physical distancing, social distancing, and be prepared by going to the CDC website and the WHO to learn more about best ways and best practices. And I appreciate the time today.
Thank you so much, Doctor. Really appreciate you joining us this morning. And for everyone else, we're going to take a brief break and we'll be right back. So tune in. Thanks. Appreciate it. Thank you, Doctor.
Here from New York, New York. Please keep it going for Carole Montgomery, you guys. Carole Montgomery.
Thank you very much. Thank you very much. Oh, God, folks, I'm so exhausted. I was baking brownies all day for the PTA bake sale. And I'm reading the brownie mix. This is actually on a brownie mix. Step 1 says add a stick of butter. Step 2, add a cup of milk. And the fourth step, beat 50 strokes by hand. Folks, my husband doesn't get that type of treatment. I'm certainly not giving it to a fudge brownie. You know what I'm saying? So I am a mom like everyone else. I have a 14-year-old son and his older brother, my husband. I married a musician. My son's a musician. So you know what that means, don't you? I'll be working the rest of my adult life. And I did just move back here. I've been back in New York for about 6 months. I was living in Las Vegas for 10 years. Anyone in Vegas? Have you been to Vegas? Yes? Yeah. I actually moved to Vegas to raise my son. I know, that is so wrong on so many levels. I was actually working out there. I was in a couple of production shows on the Las Vegas Strip. They were topless reviews. Here's where everyone's looking at me going, wow, they really let the dancers go in Vegas, didn't they? I wasn't topless. Please. I'm 48 years old. I breastfed a child. I can wear him as a scarf. Some of the old men just got excited. Great. I hate being old. Sucks being old. God. Are there any women in their 40s? Where are you? Clap your flabby arms. Where are you? Yeah. And I hate that all you hear now is, well, 50's the new 40 and 40's the new 30. It's all a load of crap. Let me tell you something. When you turn 40, your body starts to fall apart. It really does. It's like you wake up on your 40th birthday. Hey, happy birthday! You're 40! Oh, my ass is on the floor. Look at that. How nice is that? That's good. But here's the real reason why I hate getting old. Every time I sneeze now, I pee. How sexy am I, really? Be careful right here. I have allergies. I want to cover that. So I'm getting older. My son is growing up. My son is 14 years old, folks, and he's 6'2". And it's killing me that he's growing up because I still remember, when he was a baby, I remember being pregnant with him. I had to be induced. So the doctor said to me, before I bring you into the hospital to induce you, I want you to try to induce yourself naturally. It's called natural induction. Have you heard about this? You have to make love a lot, have nipple stimulation, take a lot of long walks. So my husband's like, so let me get this straight. I get to do you, play with your boobs, and tell you to go take a hike? I could do that. Thank you very much. I'm Carole Montgomery.
Have you thought about how you're going to make your retirement funds last all the way to the end of your golden years? Well, I have. It's in my 32-step course called Sue Somebody.
Instead of working, sue somebody.
People are suing each other for millions of dollars, and you can too. Order the Zach Markowitz Sue Somebody Home Correspondence Kit. Learn how to make money by pouring hot coffee in your crotch, hiding severed fingers in the meat, stapling your testicle to a bench, and more.
Threw some water on the floor, boom, slipped on my ass, $40 million. Buy it.
I cover everything in my 32-step course, from the severed finger to the slip and fall to the old sewing needle and the oatmeal. It's everything you need to know on how to sue somebody and get rich quick.
Chop up some glass and put it in your soup and say that you swallowed it, because then you could die. That's a couple of million.
And hey, if it doesn't work, my personal guarantee. I even teach you how to sue me, because who's a bigger ass than I am? And I'm telling you, it works. This is my vacation home, my second car, my third wife.
Hey, babe.
I'm not even divorced.
I can't feel my neck. Trust me, it works.
Welcome back, everybody. I promised you DJ Fresh, but he's coming on a different segment, I promise. We're having some technical difficulties here. This is ad hoc. If you could turn the camera around, don't. But if you could, you'd see a lot of hardworking people trying to make this happen today, so I appreciate everyone's efforts. Joining me now is Andy Scott, Chief Operating Officer from the Florida Aquarium. Welcome, Andy. Thanks for joining us.
Howard.
Appreciate your time this morning. So the Film Commission, for those who don't know, is underneath Visit Tampa Bay, and certainly the Florida Aquarium is one of our shining examples of a tourism attraction here in the Bay Area that we like to promote. So Andy, the question I've been asking everyone so far, just how are you and the staff doing personally?
I think we're all doing well. You know, you get tired. It's been a lot. There's been a lot going on, and you're operating very differently. But we've been operating as the mission has not changed, just our methods. So we found new ways to do what we always do.
Yeah. And you're in a different position. A lot of us can work from home, but you have animals to take care of. So talk us through your operations right now. Obviously, you're not open to the public, but what are you guys doing internally to make sure the animals are taken care of? Do you have the correct resources? Have you seen any issues from suppliers because of this?
So you have to maintain operations. So we've been planning for a while. When we first started to see that this was a potential that it could impact our business and we could close, we jumped into making sure we had all the supplies we would need for a long extended period of time. That's buying extra food. We brought in a freezer truck just so we could hold extra food for the animals. Yeah, we have to be here every day. There is no option for us. So we have crews. We even broke our teams up. So our normal team that would all work together are now operating as 2 different teams. They're working 4 days on and 4 days off, just so that we make sure that if something happens on one team, we have another team who can step in, take over, and keep it going. So we made sure we have everything. So far, we've had no issues with supplies. All of our suppliers are delivering on time. We continue to get food deliveries. We continue to get salt deliveries and everything that we need. So we haven't seen any impact on that side of the business. It's just making sure you keep morale up. You keep the folks engaged and making sure that they're able to do what they need to do every single day.
Yeah. And for a lot of us that are at home right now, basically staying in touch through social media, you guys have been doing something really fun every afternoon with your C-SPAN. Tell us a little bit about that.
So C-SPAN has been awesome. 10 o'clock every morning, we go live. And we've been working with our social media team as well as our learning team have really been getting together and doing some creative stuff. They can go places in the aquarium that our guests may not normally go, but we're very focused on that mission not changing. And our mission is to engage audiences and help them want to be inspired to conserve our blue planet. So the way we go about that is we can bring the content to them. If you can't get here, we're going to bring it. So this morning, if you had anybody who tuned in this morning, you had the opportunity to see our Bays and Beaches gallery and have our learning team and our interpreters tell you about every animal in the habitats, in particular, talk about Cletus. Now, Cletus is important to us. Cletus is a Goliath grouper. One of the longest animals we've had here at the aquarium was here when we opened. 25 years ago on Tuesday, if you can imagine. And he was here. So to be able to learn about Cletus and how we target train, that's how we've had so many kids reaching out and asking questions, sending us messages, wanting to learn more about the animals. So we are committed every day, Monday to Friday. We will come on live at 10 a.m. and we'll take you to places around the aquarium you can't see, meet some of the folks who are doing this amazing work and caring for these animals, and see how we operate.
Yeah, and that's been really awesome. So where can people find C-SPAN? It's on Facebook, obviously, but you're on also other social media platforms?
Yeah, so if you go to Facebook, it's on our Facebook. We do Facebook Live, but you'll also see all the videos there on the Facebook. You can get links to it from our website, flaquarium.org. You can find it on our YouTube channel. We have links there, so we can take you there. But that's the best place. If you go to our social media, at FL Aquarium, that's where you'll find us.
Yeah. So let's talk about some positive stuff. Not that the C-SPAN isn't positive, it certainly is. But let's look into the future. We're coming out of this malaise at some point, hopefully sooner rather than later. The Florida Aquarium is really an anchor of downtown and certainly the whole new waterfront district or Water Street district. How has the evolution of Sparksman Wharf helped your business? Are you seeing more foot traffic? How are you integrated into that new footprint?
You know, it's a great point. What's so interesting and so awesome about it is what's happening around here in Water Street and that development is exactly the reason why we were created. When we opened 25 years ago, we were designed to be the spark of economic redevelopment here in downtown Tampa. And now we're seeing, I don't know, what is it today, $3.5, $4 billion worth of development all around us, which is really the culmination of why we were put here to be an anchor attraction. And so for us, yes, we're seeing more people on the street. We're seeing a lot of our guests giving us a lot of comments that they love now coming and visiting and taking a walk down to Sparkman Wharf. So I think we are having a great impact on what's being developed here and continuing to fuel that development. It's exciting times, and we've been waiting for this, and we've been building towards this. And there's been a lot happening here to make sure that we're doing it. Again, in our 25th, we have a lot of exciting opportunities that are not all, on hold because we're in a closure situation. We're prepared to welcome more guests, to engage more. 840,000 visitors came to see us last year, and we'll get back to welcoming them again and showing them the changes, showing them what's new, seeing new habitats, seeing new animals. It's exciting stuff.
Yeah, I really appreciate you guys being there, and certainly with C-SPAN has brought some joy to all of us over the last few days. So really appreciate that going forward. Again, looking into the future, when this crisis ends, what are you most looking forward to getting back to as far as normalcy, both yourself personally, but maybe talk about what you're hoping to experience when the doors open again at the aquarium as well?
I think for me personally, we're so used to smiling, laughing children running around this facility every day. It's very quiet here. So noise. I'm looking forward to that laughter, those smiles, and that joy in this building personally. And I think professionally, we, the Florida Aquarium, we are eager and excited to get everybody back in and just fill this place. It is a different space when it's as quiet. Well, I'm standing in front of our pan window right now, one of the busiest attractions we have here at the aquarium, and I can sit here and talk on camera. I should not be at this time of day be able to talk on camera, and you could hear me with the noise that would be in here. So we're excited for that. I think normalcy will get us back to our routine. We have a lot of guests we want to engage with, share the beauty of this amazing world that you can see behind me, and tell the amazing stories and keep our conservation efforts going. So we want to get back with everybody being able to do that physically here at the aquarium, and I think we're excited to be able to reopen these doors when the time is right. We'll get these doors open and welcome guests back in. Also, just to get some of this back in their life. I think we're all trapped at being at home. We're used to sitting in our house and catching a lot that we can on whether it's online or it's on the television. And I know everybody's itching to get back out, and we're excited to be ready and opening as soon as we can and welcome our guests back in.
Yeah, and let's talk about a little about those conservation efforts. I know there's a big push right now. Tip your service workers, but I think a lot of 501c3s that really depend on a lot of fundraising, they're going to see a hiccup here because people's pockets are a little tighter than they would have been otherwise because of this. What can people do to help your conservation efforts? Are there any fundraising mechanisms they might be able to help donate to the aquarium during this time?
Absolutely. As you mentioned earlier, we care for these animals each and every day. So that doesn't stop just because we're closed. But unfortunately, because we're closed, the revenue that we get from the gate admission does. We did a sea turtle release just last week. We returned 2 sea turtles back to the ocean on the Atlantic coast, and that work has to go on. So what you can do to help the Florida Aquarium is you can adopt an animal. You can symbolically adopt one of our animals. If you go to flaquarium.org/adopt an animal, you can right now sign up. You can be an adoptive parent of any one of our animals. You can pick your favorite, whether it's an otter or my personal favorite that I already adopted, this green sea turtle. You can adopt one of those animals, and all of that goes directly to helping us serve our mission, even when our doors are closed. Whether that's caring for and feeding these animals that we have here on campus, whether that is rehabilitating sea turtles, or the amazing coral conservation work that we continue to do at our Apollo Beach facility. Being able to have your dollars go to support those efforts, adopting an animal is huge. And if you can do it, we'd really appreciate it, because it's really a part of helping to make sure the mission keeps going forward.
Yeah, that's awesome. Pete, do we have any questions from the audience?
Yeah, we'd like to know, did you guys already discuss something else, how they can donate or help?
Just ask that question. Yeah.
No, most of the questions are asking.
Okay, so we actually have a lot of live listeners that are looking to figure out a way to donate, so I'm glad we asked that question preemptively. Anything else from the audience? Another question?
No, the only other question somebody asked us is... You already answered that one too.
Okay, I'm Nostradamus over here asking the right questions. So I think with that, Andy, we'll close out the segment. Thank you so much for joining us this morning. Really appreciate it. And then once again, where can people find C-SPAN every day?
Facebook Live, at FL Aquarium is where you can find us on Facebook Live every day, 10 a.m.
Fantastic. Looking forward to tuning in. So thanks again, Andy. Really appreciate your time. Everyone in Tampa, make sure you're staying involved with your local community and certainly with the Florida Aquarium. So we'll be right back in a few minutes. Thanks, guys.
Jeez, remember your first car? Your first car, there were no seatbelts. Remember what the seatbelt was? That was your mama, wasn't it? Oh my God, you'd be driving along and boom, remember that? Boom! Boom! Like about the third light, you're like going, gosh darn, Mom, just let me go through the windshield. I can't breathe. Oh my God. Jeez, all the neighborhood kids know and yell shotgun at our house. The car pulled, the kids get in there, full football gear, man. It was crazy. There were no power windows. No power. You know how hard it was to look cool, flipping somebody off with no power window? Pussification of America. There were no cup holders. There were no cup holders, people, remember? Used to hold steaming, hot cups of coffee, 3,000 degrees, dude, right in my crotch. And if you spilled it, you didn't sue anybody. Thank God. This way, gosh darn it, I wish I had a cup holder. It's the pussification of America. I grew up in a poor neighborhood near Nogales, Mexico. I grew up in Tucson, Arizona. I didn't always live in Los Angeles. We were so poor. Oh my God, we had a TV with a coat hanger for an antenna. Yeah, aluminum foil on the top of it. Yeah. And the remote control was my little brother. We were tough. Remember that? You could change the channel, right? And he had to go through 6 feet of shag carpet.
We were tougher as a pussification America. We were so poor we couldn't afford a piñata for birthdays. We had to keep my uncle in the crotch till he was candy. We lived in a Mexican neighborhood except for one guy who was Irish Mexican. His name was Carlos Murphy. Every morning that guy would knock on our door. Oh, top de mañana to you, mi little pendejos. God, we were so close to Mexico, we would get Telemundo. Telemundo on one of our 3 channels. And we get the Beverly Hillbillies in Spanish. I remember the theme song to this day. Es un de su mi historia, señor, se llama Jetta, pobrecito caballero, very kept standing good. Laying in a dean while I meet for comida, up through the ground come a bubbling crew.
Hi, I'm Zach Markovitz of Markovitz, Makowitz, Sakovitz, Bondanovich, Johnson, Johnson, and Walker. Have you ever been the victim of an auto accident or suffered severe emotional distress from a defective product? Has this ever happened to you? Hey, how you doing? Or how about this? If any of these things have happened to you, you need to call me, Zach Markovitz, because I'll make your case. And remember, if you don't have a case, we'll make one up. Fabrication is our business. We tip the scales of justice in your favor. Call today.
All right. And we're back, everybody. Once again, my name is Tyler Martinovich, Film Commissioner for Hillsborough County. Joining us this segment is Tampa's favorite DJ, DJ Fresh. Doug, how are you doing, buddy?
Hey, I'm alive and well. Just been sanitizing up a storm, washing my hands for over 20 seconds, and trying to stay creative throughout this whole situation.
Yeah.
How you guys doing over there?
I'm surviving, man. So let's get the doom and gloom out of the way, and then we'll get to some positive stuff at the end of the segment. I work in the film industry. You work in the live events industry. I think we're intrinsically tied together with the gig economy, certainly hospitality as well. We have all basically been put out of business as a result of this. Has not been a fun time for anybody, obviously. But I think in the live events community in particular, there's been this huge push through social media, whether you're a musician or a DJ, to do sort of these live online events. What have you been seeing in the community, and what are you doing?
Yeah, so obviously I started, just personally kind of suffering 2 weeks ago. I had, a huge, I had the NFL coming down with about 900 employees for a big, huge summit. That was canceled, followed by just, I do a lot of corporate events across the country. And, it was just like falling dominoes, just one after another, calling, canceling, not even really postponing, just everybody just really just putting a halt on everything as a, precaution with all the travel restrictions and everything else going on. And then once that transpired, which was the weekend leading into St. Patrick's Day, really it just put a halt on all things hospitality and nightlife. We worked as long as we could with still being in the safe restrictions of everything. But once they kind of announced kind of the severity of it and how it was starting to trickle down here in Florida, that's when we as a whole just said, okay, listen, let's be safe. It's always better to be safe than sorry. However, we also, just a couple days after that, really didn't have an opportunity to work because everything just shut down. So what I decided to do, I'm Irish. For the last 20 years, I've thrown the most outrageous, crazy, St. Patty's Day events. So what I said was, all right, well, let me just go live from, I was kind of depressed, all that set in. Monday, Tuesday was just a doom and gloom couple of days for me. So I said, all right, you know what? I know there's a lot of other people going through, even though I have literally no business. I'm currently unemployed. I have a creative agency too, and we're doing a couple little things, but 99% of my income completely just went away. So instead of, kind of being in that depressive state, because it was St. Patty's Day, I said, you know what? I'm sure there's a lot of people stuck at home, a lot of people stuck at home with their kids, a lot of people that, want to keep their phones on silent.
Yeah, hold on, Doug. Sorry, I don't know who this is.
That's a loud ring.
Okay, there we go. This is fantastic. That's a faux pas on a film set if there ever was one.
Rookie move.
Yeah, if you didn't know this was a live show, you do now.
All right, let's send Pete out of the room. Let's get Pete out of the room if it's Pete's fault. I'm just kidding. Yeah. I love you, Pete. No, but what I wanted to do is, for St. Patty's Day, nobody could go out. Nobody wanted to do anything. The fear was so hyped by the media, and maybe it was worth it. Maybe it was too soon. Who knows? It's not our place to decide that. But nobody could go anywhere for St. Patty's Day. So I said, you know what? Let me do something from my house. Let me just do. I said, you know what? I'm just gonna do a live. When the sun was going down, I said, let's do a live sunset DJ set from my backyard. So luckily I have, a nice backyard that the entertainment industry and all my gigs, working hard, has provided me with. So there's the backyard setting right there. So now it's been forcing me to work kind of from home, which is good. But I said, you know what? Let me see how crazy we can take this. I don't really do lives that much, only if it's like, hey, I'm at this, event, come check it out or whatever. But I had my buddy come over with a drone. So we had this amazing aerial visual flying around, showing different angles, showing, downtown St. Pete and, giving everybody kind of just a breath of fresh air, even if they're stuck at home. So it was just my way of still connecting with everybody and still showing everybody, hey, we can still be creative, we can still be positive, we can still be uplifting during this time. And most importantly, the creatives, we can still be creative during this time too. My ADHD, if you will, won't let me sit still for very long. So I have to constantly be doing something. So that was kind of a gateway. And then what I really thought was amazing was the response I got. This was, in a way for me to, be a creative outlet, but it was also, I did this for everybody, for the people that were stuck at home, for the people that were already going stir crazy. And this was only 2, 3, maybe 4 days tops into quarantine, or self-quarantine, if you will. but the response I got from everybody was so uplifting and so heartfelt and so positive. And so thank you for doing that. People were sending me videos of their kids dancing because they had it on their smart TVs in their living room. They were literally like at home watching a full-fledged concert. And I just thought, wow, if that's kind of the reach that I can have during this downtime, well, what else can I do? And that's what kind of spiraled into this event that we have going on today at 5 o'clock Eastern Standard Time. Which is a great, amazing nonprofit organization, and Feeding Tampa Bay. So it was just, by doing a few of those at other places, obviously now the restrictions are going to be a little bit differently after, I think, midnight tonight or 10 p.m. tonight. But, we wanted to do as much stuff as we could and try to help as many people as we can during this time. It's only going to get, I personally, and this is just my personal opinion, I feel like it's just going to get worse the next week or two, really, really heavily here until we can, as everybody's saying, flatten that curve. So what we do now really will define us as business owners, as entrepreneurs, as creatives, as just decent human beings. So I think it's important to stay creative, stay in contact with people. I really applaud you guys too for having me on and having me on this platform and willing to talk about what we can do, because like I said, what we do now, we can either let this fold us, or we can come out of this even stronger with more contacts, more connections, more positivity. It's going to hurt financially, yes, no doubt. But like I said, what we do now defines us and how we're going to be a month, 2, 3 months from now when we continue to build back up.
Yeah, that's awesome. And since you brought up Feeding Tampa Bay, let me plug my own. We've also partnered with Feeding Tampa Bay through Visit Tampa Bay. If you go to shop.visitTampaBay.com, if you buy our new cookbook bundle and local cocktail recipe books, I think it's $20. 100% of the proceeds go to Feeding Tampa Bay till this crisis ends. So that's one way you guys can help out. Going back to the 13 Ugly Men, Doug, how can people participate tonight?
Yeah, so obviously there's no cover charge. It's completely free. So yeah, what we're doing is I'm basically taking over. And if you're not familiar with the 13 Ugly Men, I highly suggest that if you're in Tampa Bay, it's such an, and even if you're not, if you just want to support just an amazing organization. This started back in the year 2000. It was a group of like 13 guys that came together, kind of poking fun at themselves. But these are doctors, lawyers, health professionals, entrepreneurs, business owners. It was a group of 13 guys that got together and said, hey, we really want to make a change and do a lot of good, amazing things for our community. We want to help out nonprofits. We want to help raise money. So what they started doing is they started throwing these very elaborate parties. You had to dress up, a white party. If you weren't in all white, you weren't playing the role, then you didn't get to come in. They really set the tone for a higher end level of partying, but partying for a purpose. So they're a nonprofit. The proceeds go to everything from Moffitt Cancer Research to Big Brothers Big Sisters to the Boys and Girls Clubs to cancer research, and they always plug. They're so in tune with a lot of different organizations. So now they have 27 members. They put on everything from the Derby party to a 3,000 person attended Halloween party every year at the Cuban Club. So I do a majority of their events, and they're just really a great group of guys, and they really go above and beyond rather than just donating. They're present. They go to community outreach, programs. They are heavily involved in the community in these organizations too. So it really speaks volumes about not only the organization, but about each individual person attached to that. So if you could, I highly suggest that you add them. It's 1313 Ugly Men. And add them up on Facebook, add them up on Instagram. They really do a lot of amazing things for our community here in Tampa Bay. But more importantly, today, 5 o'clock p.m. Eastern Standard Time, I'm going to do a 1-hour DJ set from a visually stimulating location, which is Water, WTR, at the Godfrey Hotel. It's right on the causeway. So we've got the bay, we've got their pool. They've got a cool, huge, LED screen and DJ booth that's kind of very Vegas-esque. The pool is closed. We are not inviting anybody out there. It's closed down, obviously, because of the protocols, and we're following the strict guidelines. There won't be anybody out there, so I'll be in a safe distance. We just wanted to give everybody a cool, fun, visual, stimulating, visual to watch while I'm DJing. But we'll be engaging with you guys and talking about, kind of what other events we have coming up and things of that nature. But really, this is a goal to try to raise funds. We've got, I think, $7,300 now. We're a little over halfway. Our goal was $13,000 to reach so that we can feed 100,000 meals to people that are in desperate need of just being fed. There's a lot of things that get overlooked during a pandemic and during a global crisis like this. And with everybody literally just being wiped out of work immediately, it almost seemed like it was overnight. This is a great way for a lot of people to really step up and do whatever you can. If you can't, donate financially, maybe donate your time. If there's some canned goods that you have around, give them to Feeding Tampa Bay or Metropolitan Ministries or one of the other amazing organizations out there. But just, do whatever you can within your means, obviously, to keep supporting and keeping that good positive energy going around.
Yeah, and that's awesome. And for those that don't know the good work that Feeding Tampa Bay does, they combat food insecurities throughout the Bay Area, one of the best organizations, really affecting people on a personal, meaningful level by providing meals they wouldn't otherwise have. And certainly, as Doug alluded to, there's a lot of people that were food insecure 2 weeks ago, and there's even more this week, especially as those people that work in the gig economy who worked paycheck to paycheck don't have those paychecks coming in. So the services of people like Metropolitan Ministries or Feeding Tampa Bay are needed now more than ever. So really appreciate 13 Ugly Men's efforts, and certainly yours as well, Doug. So final question here. I think the special event industry is really the canary in the coal mine as far as seeing when this crisis might end, or at least the comfortability of people to rebook events. Are you seeing most of your corporate events canceled through the end of April, or is it pushing into May now? I mean, how far out have people canceled or postponed?
Yeah, I mean, I'm still waiting on one event that was supposed to be held in New Orleans for Choice Hotels. That was the second week in May, and honestly, I don't see any light at the end of the tunnel on that one, just because I think it's kind of too soon. But everything for me has been canceled or in the process of being postponed, really kind of through June. I do a lot of stuff on Major League Baseball, and even our MLB All-Star break. They're not even sure when that's going to be. So really, there's just a lot of uncertainty right now. The main thing I think is just be positive. If you're in the events world like I am, do whatever you can to, try to postpone the event, hold that retainer, for a future date. It's been really hard for weddings too. Weddings, it's just been really, hard for these bride and grooms to, to really postpone everything and have to rebook. So right now, it's just important to keep your calendar clear, really make sure that you are inputting so you don't double book. But just take it one event at a time. But as of right now, everybody's really pushing a lot of stuff to fall, is what I'm seeing. So just be really careful, because your August, September, October, that's normally really busy, is about to be, even crazier. Yeah. So is at least what I'm seeing personally. Yeah. And I have about 13 different DJs that work for my company, DJ Fresh Events, scattered across the country. And that's kind of the trend, at least that we're seeing for now. Yeah. But it's still really soon. So I think in another week or two we'll really be able to have more insight, because this is still new and it still hasn't really hit yet in a lot of states. Versus West Coast versus this coast, versus New York versus the South. Yeah. So I think in another week or so we'll really be able to see what is going to happen, and then we'll be able to kind of have a better idea, and our clients will have a better idea of when we'll be out of this, so we can continue normal business. Yeah.
Well, let's not end on a downer, because I do think we're going to come out of this at some point and possibly have one of the strongest falls or late summers we've ever had. But for those that are tuning in right now, definitely tune back in tonight at 5 p.m. Was it for 13 Ugly Men?
5 p.m. on Facebook, which is the 13 Ugly Men Facebook page. So that's 13 Ugly Men. Just add them up and tune in at 5 o'clock. It's going to be a lot of fun. I'm going to be mixing up all kinds of music. When it comes to music, there's no discrimination. I'm going to be playing a little bit of everything for everybody. 1 hour. It's a beautiful venue too. They've been so great to support, and when they open back up, make sure you support them too. They throw some amazing pool parties, and they do a lot of community effort events too, with giving back to charities, which is great. But yes, ending on a positive note, what I really think is going to happen is I think that people are really going to be so stir crazy. They're going to want to just literally get out of their homes as much as possible. They're going to want, and they're missing that social interaction. They're going to want to see their friends. They're going to want to be able to meet new people. They're going to want to be able to network and market to grow their business. So I think we're really going to have a huge influx of business, and we're all going to be so crazy, we're not even going to know what to do. So like I said, input those events in those calendars, because you're about to see a real storm in a good way once we get out of this.
Absolutely agree. Doug, really appreciate you joining us for that segment. We're going to close it out right now. We'll be back with another segment in a few minutes, so tune back in. We'll see you in a bit. Thanks, Doug. Appreciate it, bud.
Thank you.
Hey, we're back. We had a host had to go to the restroom, so that's why. So we're back, live stream Tampa.com. Is that where we're at, guys? Livestream Tampa.com? All right, so if you're not already there, you don't even know that I'm pitching that, so forget it. Anyway, we have Carole Montgomery live from New York. She's online. She is the creator of a Showtime special called Women of a Certain Age, featuring women 50 years and older that are super stellar stand-up comics. So, Carole, tell us a little bit about your Showtime specials.
Well, how do I start? I came up with the idea about 2.5 years ago, and I was doing a podcast with a bunch of my friends who were all over 50, and we had such a fun time doing it. And I said to my husband when I was coming home, I said, this should be a show. You know, just because so many of these women that I know, they're not, you know, some of the women on the special you've heard of, but a lot of these women are unknown women. And they're all working and, you know, doing what they do. I said, let's do a show. So I started with a live show. And from that, I mean, it really, when you think about it, the amount of time it took from idea to television was pretty fast. Because I came up with the idea in March of 2017, and we had a special on the air in March of 2018. No, wait a minute, 2019. So it went fast.
Okay.
It's basically both specials are. I'll plug both of the specials. The first one was called Funny Women of a Certain Age. The second special was More Funny Women of a Certain Age.
That's clever.
Yes, clever. And then the third special is going to be even more funny women of a certain age. And the fourth special is going to be yes, there's a lot of women who are funny.
Okay, and then Revenge of the Women of a Certain Age, maybe.
Right, we can do that. Maybe for the
It's a franchise. It could be like Fast and the Furious, but with women.
Yes. And so the first special starred Fran Drescher, Lunel, Lynn Koplitz, Carrie Louise, Vanessa Hollingshead, and myself. And this was really exciting. We just found this out when we were doing press for the second special. It was Showtime's highest rated premiere of a stand-up comedy special of 2019.
Nice. And now, can people stream this now? Where would they find the original one?
The original one is also on demand. So you just look up Funny Women of a Certain Age and it'll pop up. And then the second special, you know, we did so well. We taped in October, and it just premiered 2 weeks ago, just before the quarantine, which is actually the one upside of the quarantine. So when I accept my Emmy next year, I'm going to thank the coronavirus.
All right.
Because, you know, everyone stayed home and watched it, so I'm sure that the ratings went through the roof. But that one stars Caroline Ray, Thea Vidal, Carol Leifer, Tammy Pescatelli, Julia Scotti, and myself. For some reason, they want me to be the in all the specials, which is great for me.
That's good. It's just like you got a regular gig. So what about the chances of Carolyn Ray getting that talking cat from Sabrina? I mean, that would be, I love that cat.
I think that cat's probably dead now.
Well, it was a puppet, sort of.
What?
Carol, it was a warlock. It lives forever.
Oh, it's a warlock. Well, oh, yes, I'm right. You, as you're wearing your Black Panther shirt, of course, believe in that crap.
In college, we used to drink every time the cat talked.
Oh, that's hysterical.
Oh my God, you got hammered by the end of the show.
Oh, I'll tell Caroline that. She'll love that story. She'll love that story.
All right. So anything else you want to add? Mr. J. Hewlett is coming up, and I know you guys have worked together.
Yeah.
We just played your Sue Somebody clip where you worked with him and did some comedy for the Damage Control sketch group.
He makes me laugh like nobody else. Him and Martin, another member of the Damage Control group, just make me laugh hysterically. I mean, you know, what I tell people, you know, when people ask me, what am I doing? I mean, like, I'm still trying to be creative. I have a lot of merchandise that I can, we have Funny Women of a Certain Age stress balls, which I think everybody needs right now.
Everybody needs to grab a ball right now.
Yeah, everyone needs to grab a ball.
Especially you.
If you're interested in that, you can Venmo me. I'm sure that you have my Venmo name up there. Oh, I shouldn't have touched my face.
Oh my God, you touched your face. It's over.
I touched my face. I'm going to die.
So tell us though, you're in New York. So tell us about that, because everybody looks at that on the news and they're like, but New York and New Orleans seem to be kind of like the the hot spots of quarantine and death. What would you say about that, living up there? What are you doing?
I will tell you this. We are the epicenter.
Okay.
And I'm very calm. I'm very calm by when Governor Cuomo comes on every day at like 11 or 12, and he talks and he gives a press briefing. And I was actually pissed at him because we did the Today Show actually 2 weeks ago today, and when we did 2 segments, and literally they were literally going coming up. On presser, so thank God he got off for the second segment. So now I love him because to me he calms me down because he's really talking facts.
Yes.
And telling us what's happening, and it is very scary. Like my husband and I go out and we walk, like we try to walk every day because the gyms are all closed. So we do a walk in the morning, and it's deserted. It really is deserted. It's nothing like I've ever seen in New York City. The streets are empty. There are people walking around. There's a lot of people wearing masks and protective gear. And it's like, guys, every time you buy a mask for yourself, you're taking it away from the people who really need it. Like, they've already said regular people shouldn't wear masks.
The hospital workers are running out.
Give them to the doctors and give them to the nurses and the personnel and the cops and the firemen.
Jokes?
So, and it is scary, but the great thing about Cuomo is he tells the truth. Like he says, yes, it's going up. The rate of people that have it are going up. Like today, he actually did something that really calmed me. He said, okay, we have X. I don't remember the numbers, but we have these many cases. But out of those cases, 80% of the people who have it resolve it by themselves.
Yes,
and that's
of course.
Huge. That's huge. That's not as terrifying as hearing everybody's dying. Everybody's dying. So he brings a calm to this whole thing that we're living by telling us what's happening. He said the people that are most of the people, yes, are the people who are, the high risk categories. They are the older people with compromised, and that's most of the people. You will get somebody. You hear the internet stories of somebody was 12 or he was 20, and that's going to happen too. But they probably had a compromised immune system. So he's been great. So I know it's scary that people, like friends, I used to live in Vegas, and they're like, "Are you okay?" And I'm like, "We're fine."
Right.
We wash our hands. We do go out every day. We try to do social distancing. I haven't seen my son since this started, and that kills me. But we do FaceTime and all that stuff.
Oh, sorry. Go ahead.
Go ahead.
I was going to say, talk a little bit about the dealing with this situation with humor, since you're a comedian, and talk about also the state of the industry for work.
Well, we're trying to figure that out because when this first started, I did a live stream show out of Stand Up New York because we wanted to bring comedy to the community. Now, I've been doing stand-up for 40 years, so I know where the laughs are. So if there's no laughter, I know where to pause. But I watched some of the younger comics struggle with the fact that you're playing to an empty room and you're playing to a camera. So that's hard.
Yes.
I don't know what live entertainment is going to look like after this. That's the only dire thing I see in the future, is because there's going to be a lot of people who don't want to go out. They're going to be afraid of being in crowds. Like, we literally walked down the street yesterday. A New York City block is a big block, and there was an older couple who were in full gear, and they waited till we passed them to walk by us, and we looked at them and said, "We are way over 6 feet. You are overreacting." And I think you're going to get a lot of that.
Yes.
Now, that people are just going to overreact to it. So I really don't know. We're trying. I know you're probably doing the same thing. We're trying to make content that doesn't have to be with a live audience. I don't know if stand-up comedy is going to survive this.
Okay,
because we need a live audience.
Now,
the only thing I can think of is if you do, like my son said to me, because he's crazy. He said I should do. I have all these Funko dolls, the pop-up dolls, the cartoon characters. Do you know those dolls?
Yeah, the ones with the big heads.
Right. He said I should just play to them now. I should just put them all on the floor, and that's my audience.
And how is your...
Well, unless we get laughter out of it, how are we going to do that? I mean, somebody will come up with the technology where, like what we're doing now for the live stream, where there'll be an audience. Someone will have to come up with that, even if it's to the fact that we're all watching, and we'll be able to, like everyone will be watching on the computer, so you will get to hear the laughter.
You can do Second Life kind of an audience like that now, where you have an audience of virtual people. Yeah.
I think that's going to happen. I think there's going to be a lot more of that. And I think that virtual contact is going to be huge. I haven't felt like I had anything to do. What's funny is because I actually put makeup on for this, which I haven't done, and washed my hair. So I said to my husband, I said, after I do this interview, I'll probably put up some content because I don't look like crap all the time. By the way, this is the T-shirt I'm wearing all the time now.
Oh, yeah, it's better than the Black Panther.
It's bah humbug.
Okay. Also, Venmo. Pitch your Venmo real quick. We've got to go in just a minute.
Okay. If you want to buy merch or you want to donate because I've lost 2 months of work, you can go to Carole Montgomery 60 and throw me something. And if you want, please let me know you want one. I have tote bags, which is very what's the word? Earth friendly. And I have the stress balls, and I have CDs that actually Gene makes copies of. So
yes.
If you want a CD,
that was live at Coconuts, right?
Yes, that was live at Coconuts.
Carole Montgomery live at Coconuts. I can't remember what the title is, but
it's called Because I Said So.
There you go.
So you can find it. It's all over. It's on Amazon. It's on CD Baby. But the one thing I do want to say to everybody is this is the first time in everyone's lifetime that we're all in this together. This isn't just a United States thing. This is a worldwide thing. Everybody is going through the same thing that we're going through now. So to me, that's a sign to realize that we're really all connected, and we got to start treating each other better, man, because obviously Mother Earth is about to shake everybody off of here.
I agree, 100%. Any jokes for this situation? Have you seen anything online related to the situation that was funny?
Well, here's my view. And I've posted this on social media. When this is over, every comedian gets to do one Corona joke. That's it. One. And it's going to be the one with the lime and the beer. So we all know what's happening. Do the joke, then move on. We have other things to talk about. We're in it now. I don't want to hear it anymore.
Gotcha.
So just move on. Let's write about some other funny stuff.
All right. Well, very good. Right. That's good to hear from you, and be safe up in New York. And everybody else, we'll be back very shortly with comedian Jay Hewlett.
Bye.
Bye.
Have you thought about how you're going to make your retirement funds last all the way to the end of your golden years? Well, I have. It's in my 32-step course called Sue Somebody.
Instead of working, sue somebody.
People are suing each other for millions of dollars, and you can too. Order the Zach Markowitz Sue Somebody Home Correspondence Kit. Learn how to make money by pouring hot coffee in your crotch, hiding severed fingers in the meat, stapling your testicle to a bench, and more.
Threw some water on the floor, boom, slipped on my ass, $40 million. Buy it.
I cover everything in my 32-step course, from the severed finger to the slip and fall to the old sewing needle and the oatmeal. It's everything you need to know on how to sue somebody and get rich quick.
Chop up some glass and put it in your soup and say that you swallowed it, because then you could die. That's a couple of million.
And hey, if it doesn't work, my personal guarantee. I even teach you how to sue me, because who's a bigger ass than I am? And I'm telling you, it works. This is my vacation home, my second car, my third wife.
Hey, babe.
I'm not even divorced.
I can't feel my neck. Trust me, it works.
Hi, I'm Zach Markovitz of Markovitz, Makowitz, Sakovitz, Bondanovich, Johnson, Johnson, and Walker. Have you ever been the victim of an auto accident or suffered severe emotional distress from a defective product? Has this ever happened to you? Hey, how you doing? Or how about this? If any of these things have happened to you, you need to call me, Zach Markovitz, because I'll make your case. And remember, if you don't have a case, we'll make one up. Fabrication is our business. We tip the scales of justice in your favor. Call today.
Jed Clampett. All right, we're back here, Channelside live streaming. This is like the Beverly Hillbillies of Tampa, right here, right, Jay?
Yeah.
I'm like the Jed.
Gene.
I'm like the Jed Clampett of Channelside.
Yeah, there you go.
So this is Jay Hewlett. Oh, look, it's Chris Farley and a belly.
Yes.
You need to start working out, Jay. That's terrible.
That's what I said. Lottie freaking Dodge.
All right. So anyway, Jay, you're out in L.A. and you do stand-up comedy. Tell us a little bit about what's going on in the stand-up comedy industry right now, which is probably not much.
Zero, Gene. Absolutely zero.
All right.
Yeah, I do gig salad out here a lot during the fall and whatnot, so I get a lot of gigs through that and Thumbtack. A three a month, and they've just been cut off completely. But there's bright sides of the quarantine. It's liberating. I haven't shaved my legs in 3 days, so that's good.
Nice. And you guys are also doing, are you still doing the Denny's, comics at Denny's? What's that called?
Yeah, we do comedians at Denny's, and we do a show a week. Once a week we usually get together at Denny's, and then the next week we just talk road stories and stuff, and we've already taped that. So one's live and one's pre-recorded, but now we have to Zoom it. So we did our first Zoom show Wednesday. Came out pretty good.
Okay, and obviously you're not going. Obviously you're not going to Denny's. Do you put up like a fake Denny's sign behind you, like at your house, or what do you do?
The week before that, we didn't meet at Denny's. We actually met at Lauren's apartment. We had Denny's deliver food.
Oh, so all right.
Yes, so they came in with the logo and the bag and the whole bit. And we had Stephanie Blum on. She's hilarious. One of the funniest housewives, and a lot of TV credits. Extremely funny. So now we just have the logo, and we do the logo thing with the Denny's. It's our own logo because we don't want to violate anything. And then we just sit around and we try material, and we have like a set show, like a improv format.
Okay, your audio is a little low, Jay. Maybe get closer to your phone. Let me see. Hey, that's a good shot. That's great. Yeah, it's like the old MTV days when they actually played music, right?
Yeah, hold on a second.
Oh, wow, that's great. It's like Blair Witch.
There we go. How's that? A little better?
I think that's a little bit better. But you're looking pretty. You're looking pretty dapper. I see. Besides not shaving your legs, you at least shaved your face, most of it.
I have been shaving my face for the most part, but you know, there's no one here really to impress unless the ladies want to contact me online. I just want to guarantee to them, even if we were to meet in person, wouldn't be long exposure because I am quick. Be the best 30 seconds of their life, Gene.
All right, Jay. And so I know you usually do tours in Florida coming up in the summer. So what's going on with that? Is that completely on hold?
Well, it just depends if it's really mostly the clubs at that point, if they're still, you know, up and running. That's the problem. They got to build their business back up. I don't know if they can ramp up that quick. And if the restrictions are loosened, right? So you guys aren't having any. You can't meet in restaurants right now, can you?
Not really. And then What about, how are you dealing with it from a comedy perspective? Are you taking the time to write comedy? Are you writing coronavirus jokes, Jay? What's going on out there?
Yeah, well, the same thing. I've been doing. Actually, that's been the best part of this whole thing, is it's given me a lot of time to write. So I put 1 or 2 things up on Facebook and do some Instagram stuff and do some Twitter. But I've got sheets. I got sheets and stuff that I've been writing. Like, I can't show you everything, but lots of material. I'm not sure how it'll translate to the live stage, but writing-wise, it's been great.
All right. So are you working on any like? Because I know you're a big musical guy, Jay, and I know you like to dance. What are some of the music? Are you working on any musicals right now?
Any musicals? Yeah, I have an ABBA kind of musical that I'm going with, that I'm going to break out when I get out to Florida.
Jay, that's been done. I think we need to move on to like White Snake or something. If we did like a White Snake musical based on
I don't know, maybe some yacht rock.
Oh, we could do a yacht rock, and do a little Christopher Cross, from the sailing into the Doobie Brothers, and then right into some kind of like Boz Scaggs kind of deal. Do a Lido shuffle. Yeah. Maybe the lead character is Lido, and he shuffles his way through the musical, Jay.
Yeah. So Lido's good, along with Play That Funky Music, White Boy.
Yeah, Play That Funky Music. So Jay, who are some of your other comedians that you've been working with out there, and some of your favorite comedians that you could talk about?
Well, I was excited. I thought Carole and I were going to be on the same show.
Yeah, Carole's got she's quarantined, Jay. We sprayed her with Lysol, especially right through the computer. We sprayed her and her entire family.
Yeah, because I mean, when you're all together like that, I'm in here. It gets tense. I've already had to sue myself for sexual harassment.
Oh yeah, that's right. If you saw earlier, we ran the Sue Somebody clip, which is Jay. He's got a lawyer that he plays, and they do comedy bits. And of course, the whole thing is you're an injury lawyer, but you're basically injuring everybody in the spot as you.
Right.
So I think you kick Ken in the groin, and then he falls over, and then you punch Erica in the face, and then we'll go ahead and play it. You want to play it? Can you get that queued up, Ken? All right, Ken's going to go ahead and play the clip, Jay. That way you and I can sit on our butt and do nothing for. Oh, are we going to talk about it? Go ahead and play the clip.
Hi, I'm Zach Markovitz of Markovitz, Makowitz, Sakovitz, Bondanovich, Johnson, and Walker. Have you ever been the victim of an auto accident or suffered severe emotional distress from a defective
Is it just B-roll, or do we have?
Has this ever happened to you? Hey, how you
Jay, we're talking about it right now, even though there is there audio on it? It's the director's track, Jay. Okay, here we go. You can't see it, but this is the part where you kick Ken in the balls.
I'll make your case.
Oh, wait, here comes the part where you punch Erica.
Remember, if you don't have a case, we'll make one up.
And then,
wait. Is our business.
And then see, you're like a shady guy, and you're hurting people, and you're injuring people as you're promoting yourself as an injury lawyer. See?
Drumming up business.
It is hilarious, right?
Drumming up business, Gene.
Yeah, I know, exactly. So tell us about, you're part of the Damage Control Comedy Group. Tell everybody how amazingly awesome we are.
Yeah, you guys, amazingly awesome, except when I need my 1065.
Oh, yeah. Yes, when you need your 1065, that $22 that you made from our royalties doesn't help much. Well, doesn't help with the home loan.
Our careers are on a rocket, Gene.
Yeah, I know, Jay.
Actually, from the previous question, I saw Carole out here in October.
Okay.
And, so she spent a whole 7 minutes with me.
Oh, wow.
At the Improv. We were at the Improv together with, she was playing with Fran Drescher.
Okay, that's right, for the, because they were doing the women of a certain age, so they were probably prepping for that.
Yeah, which taken off, which is good for her. Now I can't talk to her anymore. She just, she's all that in the back.
She's got a big head, and she's in New York, so we have to spray her with Lysol.
Yeah, so I hope to meet up with Miss Carole again at some point. And then I haven't, this year I was trying to think of who I've worked with. I guess the most famous person in the last 12 months, well, longer than that, was Kato.
Kato Kaelin, yes. People don't know that Kato Kaelin does stand-up, and he's quite funny.
Yeah, he's a really good MC. He likes to MC. He's good at it.
All right.
So.
All right, Jay.
Yeah,
Well,
that's
anyway,
famous.
we got to hit the road here, but take care out in LA. Be safe. Spray everybody down. Do the Clorox, whatever you got to do, and
You guys got to get me back on once you pay your electric bill. You get all these tech problems.
Oh, absolutely. We'll do that. We're working on it right now. All right, Jay.
Pay
Thanks a
your
lot.
electric bill, Gene. All right, bye.
Bye-bye. All right, everybody. We will be back very shortly here, and stay tuned for some more.
Subjects today, but we're soldiering through. Been a lot of fun. Thank you all for tuning in. I feel like somehow we've resurrected public access TV.
I think we have
resurrected
public access TV.
Joining me now in this segment, live in studio, to my right we have Pete Guzzo. And for those that tuned in last week, we have again Ken from Bank of England Mortgage. Thanks for joining us. So let's start with you, Ken. There's a lot going on out in the world today. So what should real estate agents and realtors know going forward in this economy?
Well, there is a lot going on, like you said, and I'm going to go ahead and relate this to maybe something that some of our Tampa veterans would be familiar with. If anybody knows what the ride Shikra is, when we're sitting at the top and you're waiting for it to drop, that's kind of where I feel like we are right now with this business. Nobody knows what to expect. What we do know is that the buyers and sellers both have reduced somewhat in numbers, and it has balanced. The market is still very hot. There's still a lot of action, but we care a lot about our realtors and all the teams of people involved in this, and we need them to be careful and be safe and take advantage of some of the technology that's out there. Some of the other things that are really big in our industry that have been affected are the different mortgages that people are qualifying for. Last week, shortly after we had our talk, we lost a big segment of the mortgage business called the non-QM section. That's the non-qualifying mortgages. And those were all generally our self-employed borrowers that were using alternate documentation to get loans. So realtors need to know that lots of these people are still running around with pre-qualification letters, and they think that they're pre-qualified, and we need to be showing them homes. Come to find out that the loan they were qualified for no longer exists. Wow. Something else that's really big that's happening is because of our projections of unemployment, all of our government lending products are kind of under very heavy scrutiny right now because we're expecting 20-25% unemployment, and those are our loan programs that have expanded guidelines for our borrowers. They allow a higher debt-to-income percentage, and that scrutiny is coming down on those loans. The value of those loans on the secondary market has dropped significantly. I think we're going to see changes to the FHA guidelines. I think that a lot of our pre-qualified borrowers that are out there that are shopping thinking that they're okay or are maybe not qualified anymore. So we're going to have to watch the FHA loans, the USDA and VA very carefully. And realtors, I would tell you that if you have a borrower with a pre-qualification that has a date maybe back in last month on it or even a week ago, good idea to go ahead and re-vet that pre-qualification, and let's make sure that they still have the best program available to them. It's a good time to make sure you're working with responsible lenders, and those are going to be the lenders that stay in touch with their borrowers and make sure they stay qualified through this process.
Yeah. So as a homeowner and someone looking to stay in their home, is this a good time to refinance, or would you suggest waiting a bit?
If you qualify for conventional financing, this is still a good time for refinancing. Our interest rates are still very low. The big thing that you're going to see is a difference between a rate and term refinance where you don't get cash out and a cash out refinance. And a lot of people picture a refinance as a cash out refinance. And because of the way the economy is and risk is right now, the pricing or interest rates for the rate term refinance with no cash out are much better than the pricing with cash out included. So let's say if you're at, I would say, 4.25 or above, it's definitely a good time to call your whomever you do your business with and have them do an evaluation on your mortgage.
Yeah. All right, great advice, especially for those real estate agents out there in the market that are still trying to work, and those people that are trying to list their homes. All good information to have. So Pete, turning to you.
Yes.
Today we've had a roller coaster of interview subjects, from the Florida Aquarium to lawyers, financial advisors, a doctor. We've pretty much checked everyone's boxes off. Comedians. But my wheelhouse is film. That's your wheelhouse. So let's talk a little bit about the film industry to close us out today. And again, I appreciate everyone joining us. Where are you at in your business as a production company? When did the slowdown start, and do you feel like you've caught the tail of it, or is there still more of a bottom to drop out?
Well, I think like a lot of us, we got not caught off guard because we all knew about the epidemic that was happening around the world. But about 2 weeks ago, when it really started affecting the United States and it started hitting home, we had a lot of people, a lot of clients, thankfully not cancel, but postpone jobs. some of those jobs, we don't know if they're going to come back or not. Some of the clients are holding strong, and they are, no, let's keep location scouting. You know, we can't do it physically, but let's look through photos and let's do what we need to do. But honestly, what we're doing as a company is we have calls probably 4 or 5 times a day, and we're saying, everyone hold strong. We're going to get through this, and we want to be one of those companies that when this storm is over, that is going to stay on top, and that's what I recommend for everybody. That's what we recommend for our clients, ad agencies, whatever company you have. I mean, I think we're all in the same situation. Back in 2008, our industry, as you know, we're the last ones to be hit. So when we had the recession, it took a couple of years, you know, it took depleted marketing budgets until we actually realized we weren't going to continue to have the success we were having. But we're also the last ones to come out.
Yeah.
Because now marketing budgets had to get more money into them, and everyone had to get used to spending money in marketing for video production, ad agency, creative. So this time around, it's a little different because now all of us as a whole country are getting hit. And we know from the last recession that we're going to be one of the last ones that possibly could get out of this. So, you know, there's a lot of questions, but there's also a lot of reconfiguring of how we do business. So let's do more streaming. Let's do more commercials, as you've seen, that just use user-generated content. Let's create content that way, because we have to have the 6-foot law, or now even it's like, I don't know, a 6-mile law away from each other. So we just have to come up with new creative ways to create content and be there for our ad agencies and our clients and let them know we're not going anywhere. We're going to come up with new solutions, and that's what we're going to do. But the last thing we're going to do, which I tell everybody who works at Kestum Bilt, is we're not going to just curl up in the fetal position and just wait for someone to give us a solution. We're going to create solutions for our clients and agencies, and that's the one thing I just preach to other production companies as well, because Tampa Bay, we've been very successful, you know that, over the last, 5, 6
37% growth since 2018.
Yeah, and we can't let that go. We can't all of a sudden let all that growth go away. So I would suggest for any production company in Tampa Bay and Florida to just continue to come up with creative solutions, and let's just figure it out together.
Yeah, I think that's very astute for anyone who worked through in the film industry through the last recession. You know, a lot of larger clients will pre-allocate their marketing funds over the course of a fiscal year, whatever that is, whether it's calendar or they have a different fiscal year range. And that money's sort of set aside, right? It's been earmarked for that purpose. And during the recession, you had a lot of the larger companies initially try to spin their way out of the recession through higher profile marketing, really get their messaging out there more. But they had the luxury of not having a universal collapse of a lot of, just social infrastructure. I mean, right now in Tampa Bay, it's a work from home order for everyone in Tampa Bay. And the problem with that is that if you are a business that cannot restructure to be mobile or work from home, you're effectively out of business. Like there's just no way to get around that. And oftentimes the first thing to get cut from a budget is the discretionary spending that's usually allocated to marketing. So I do think we're going to be on a different bell curve than what we saw coming out of the recession as far as how we can get the ground back under our feet and really moving forward. Have you seen a reduction in overall bids? Are there still clients out there trying to look into May and June? They're looking to do pre-production now, or is just everyone sort of iced and on hold?
It depends on our customers, but the good thing is about 50% of our clients, our partners, like we like to call them, we're actually still moving forward with location scouts doing digital locations, like whatever location scouts have on file for homes, we're still looking at them. Everyone's still staying positive about when we come out of this, let's go into a production right away. Nobody knows when that is, but it's like, let's just keep working. Yeah. Let's just feel normal. Let's not end daily life the way we know it. And as creatives, our minds never shut off.
Yeah.
So for us to be able to shut our minds off is impossible. So we're just encouraging everyone to kind of keep moving forward. But clients are still, for the most part, they're still moving forward with the caveat of we don't know when we're going to shoot, but we know we need this content. But to connect what we're going through to the real estate industry and the mortgage industry, we have actually employees who are moving into homes right now, like literally moved in today. And it's difficult because they're moving into homes, and other people that they're selling their homes to now can't buy their homes. So it's a difficult process, and I didn't intend for all of us to be on the the video feed at the same time. But yeah, it's weird. Like for me, for the real estate industry, it's a real thing because we have people who are employees moving into homes, and they actually can't. It's very troublesome for them right now.
Well, in an environment like this, you really appreciate just how the economy works and how it's really an ecosystem. And if everyone sort of flatlines at the same time, a lot of those safety nets go away, and it could really be disruptive.
As my dad said, who's I won't say his age because he's probably watching right now. He's never seen anything like this, and he's been around for a while. And so I don't think any of us have ever seen anything that flattens industries across the border. It's like it's never happened. So we're just all figuring it out together, and just trusting our U.S. government and the global economy to bounce back soon.
Yeah, well, let's fingers crossed. So let's end on a positive note here. Again, thank you everyone for tuning in today, and certainly last week, and we're looking to continue this next Friday as well. But a big thank you to Pete, who's sitting next to me here. This was his brainchild to try to keep people working and active and really connect the community. So thanks, Pete, for putting this together and just thinking of it and being creative and thinking out of the box to come up with something like this.
Yeah, thank you for sitting here for 3 hours and talking.
I had nothing else to do, so here I am. Thanks again, everybody. Thanks for tuning in. Remember, you have the great opportunity to help support Feeding Tampa Bay this evening at 5 o'clock. Our previous guest, Doug, DJ Fresh, mentioned that tonight, so tune in on Facebook. Otherwise, stay engaged with us through Film Tampa Bay. You can wash your hands, find Pete, what he's up to through Kestum Bilt. And tune in next Friday, same time. I believe the same link. We'll post it again through our social media channels, and we'll have new guests. Appreciate it, everybody. Thanks. Stay safe and healthy.